My name is Scott, or most people around here call me Scotty. At UWA, we have a pretty flat structure between our academics and our clinicians and our students. We see our students who are sitting right next to me, I'll introduce in a little bit, as peers and colleagues, not as someone to learn from. And that's one of the things that attracted me about UWA Med School when I shifted here 5 years ago. And when in my role as Associate Dean Global, I get to travel all around the world, seeing all of the medical schools. So I've been to Mac, I've been to Western, I've been to University of Toronto and UBC. And what I was looking for about 5 years ago when I was looking for my new medical school is somewhere where the students were seen as the most essential part of that medical school, but also some other things that we really need to make a medical school functional and great. So a few of those things. The first of all, you need to have a really strong medical school that is based in the hospital. Now, the reason for that is that your students can then have learning all throughout the departments of the hospital. And you can see our medical school on the image in front of us. We're currently in the building at the very front of that picture. Over to the right-hand side is Perth Children's Hospital, which is the leading centre for all children's health in Western Australia. The big, particularly ugly building at the back is our Charles Gardner Hospital. That is Perth's either biggest or second biggest hospital, the other one being Royal Perth Hospital, and we have our students rotating through both of those hospitals. To the left of that big ugly building, we have some of our research centres, the Harry Perkins Centre, Lions Eye Institute, and so on. So we're really in the hub of where the research happens and the clinical learning happens. And that's something that you need to have to offer your students the opportunity to become the best doctors that they can become. The other things that I was looking for 5 years ago is that we had strong teaching facilities, but we're actually teaching medicine in a more modern way than what a number of other hospitals were. What that means is that we sort of try to get away from the lecture-based learning and spend a lot more time in the clinical learning space. That's one of the things we do particularly well here at UWA. Most of the medical programs, graduate medical programs in Australia have 2 years of preclinical and then 2 years of clinical learning when you're out hospital-based. Here at UWA, we only have 1 year and about 10 weeks until you head out clinical. And then, of course, you have almost 3 years in the clinical space. So that fast tracks some of your learning, but it also means by the time you're graduating and becoming an intern here in Australia or a resident back in Canada, that you've got more skills in that clinical space than most other people. We do have some state-of-the-art facilities, but being UWA's Western Australia's oldest medical school, we do also have some pretty crusty old places, but those crusty old places have produced a couple of Nobel laureates already. So we're pretty proud of some of those old dingy places as well. And finally, before we go to the next slide, and one of the things that really attracted me once I started digging more into UWA was the mentorship scheme that we have. So every one of our medical students is aligned to a clinical mentor, and that usually happens later on in your first year of your course. And that clinical mentor is someone who is aligned with your desires to become a cardiac surgeon or a pediatrician or whatever it may be. And they talk to you about their process to get to that place. We also have pretty amazing built-in student supports as well. So the Western Australian Medical Student Society really makes you feel a part of the team from the very start. And as international students, we put you in touch with some of the senior international students who will help you navigate the process of becoming a medical student here at WA.